In medical rounds today, your heart's racing and your heartbeat feels irregular. Are your heart palpitations normal, or could it be atrial fibrillation? Here to talk about that is Dr. Bhatt, a clinical cardiac electrophysiologist and co-director of the Hartford HealthCare A-Fib Center. Welcome, doctor.
Thank you, Kara, for having me.
So let's talk about exactly what is atrial fibrillation and what are the symptoms?
Okay, atrial fibrillation is basically an irregular rhythm of the upper chambers of the heart that can make the bottom chambers beat fast. And some of the symptoms that are associated with this include palpitations, sometimes shortness of breath. Sometimes people can feel tired. Occasionally can also have some chest discomfort and overall just not feeling well when patients go into atrial fibrillation.
Who's most at risk?
So some of the people that are at highest risk is the older you are, the higher the risk. About 20 to 30% of the people who live into their 70s to 80s will develop atrial fibrillation. Some of the other groups that are at higher risk include patients who have thyroid disorders, people with obesity, people with sleep apnea and diabetes, and also people with heart disease are the biggest patients that are at risk for having atrial fibrillation.
So what are the options if non-surgical options don't work?
So there are, of course, medications that can be utilized to help control atrial fibrillation. But if the medications are still not as successful in keeping patients out of atrial fibrillation, then some of the other things that can be done is something called an endovascular ablation, where we essentially go into the heart and we target the areas where we think the atrial fibrillation is coming from and address the issue.
So walk us through that procedure. What would that entail?
So the procedure entails, it's usually a same-day surgery procedure now, where we get access into the blood vessels in your legs, and then we essentially take catheters up to the heart, and then we go from the right side of the heart to the left side of the heart, and we essentially target what we call the pulmonary veins, which are the blood vessels that bring the blood back from the lungs. They act as a trigger or a possible spot for atrial fibrillation, so we essentially go around and target those areas to help decrease the likelihood of having recurrent atrial fibrillation.
And amazing, I guess you don't have a lot of downtime, and you can do this right here in Connecticut at Hartford with Hartford HealthCare.
That's correct. And as I said, most of the time patients go home the same day, and it changes their lives and makes them feel incredibly different than when they first walked in.
Doctor, thank you so much for giving us some more information about this important topic.
Thank you for having me.
And if you would like more information on this segment or all of the other topics we've covered in medical rounds, you can always visit our Channel 3 app. You will find them all there.